Hi, welcome to Fulton Vascular. My name is Greg Fulton and I'm a vascular surgeon at Cork University Hospital. The purpose of these videos are to provide information on vascular diseases and their treatment. For more information, you can get it from our website, fultonvascular.com, or follow us on Twitter @FultonVascular. Thanks very much. Today I'm going to talk about peripheral arterial disease to the legs. Basically, when the arteries become diseased, the blood flow to the legs becomes reduced. Classically, this occurs because of high cholesterol, high blood pressure, cigarette smoking and diabetes. And as a result, the muscles of the leg, when they start to move, they don't get the amount of blood that they need. Here we have a normal artery. It's a very good caliber. As a result, when the muscles are reacting or acting very quickly and they need lots of blood, there's plenty of capacity for this artery to provide that blood. Unfortunately, if the artery becomes narrowed, or in this case it's blocked, the blood really struggles to get to this particular part of the artery, and as a result, when there's increased activity of the muscle, unfortunately, and the blood is not there in sufficient quantities to supply the muscle, and the muscle develops a lot of pain and the patient has to stop walking. I suppose it's a little bit like having a blocked fuel line or a narrowed fuel line to a car engine. Basically, when the car is idling, everything's okay, but unfortunately when there's any activity needed, the engine simply will not perform if it doesn't get any fuel. Unfortunately, the first thing to do in these cases is you must sort out all the risk factors which caused the problem in the first place. So you must stop smoking, control your cholesterol, your blood pressure and your diabetes. And once you've optimized all of that, you then have to decide whether you're going to go and do anything more for the patient. If the walking restriction is relatively modest and people can survive well with it, it's quite reasonable to do nothing more except to try and optimize the risk factors, try and get the person to be a little bit fitter, and they'll generally do very well. But if the symptoms are very bad, the important thing then is to try and see if we can overcome the blockage. And you can really do this either two ways. You can try and get through the blockage, generally with a wire, and then use the wire to put a balloon across where the blocked artery is, and then by inflating the balloon, what you end up doing is compressing the plaque, as it's called, against the side wall of the artery, creating a way through and the prospect of blood getting uninterrupted from one part of the artery to the other. Now, in the heart, often these balloons are covered with a piece of metal called a stent, and the stent ends up being left in place. And whilst this sometimes happens in the peripheral arteries, largely speaking, for the most part, the stent doesn't confer any additional advantage, and as a result, simply the balloon treatment, which is known as angioplasty, is done on its own. Now, if this doesn't work, or if the disease is very significant, the only alternative is to put in a new blood vessel, either taking out one of the patient's veins or actually getting an artificial blood vessel. And what you do is you simply build a bypass from the area where the blood is flowing into to the top of the blood vessel, around the blockage, into an area of decent artery which exists below the blockage. This is the same concept as building a bypass around a congested town. You go from where the road is good, around the area of congestion, into another area where the road is good. So these are the two main strategies for dealing with blocked arteries in the legs. But as I said, the most important thing in the first instance is to improve all of the various risk factors which have caused the problem in the first place. Thanks very much for watching. I hope you find this video useful. For more information, check out our website, fultonvascular.com, or follow us on Twitter @FultonVascular. Bye for now.